Hello and welcome back to the Advancing Healthcare Innovation Show. I'm your host, Michael Stamatinos. And if you're new to us, welcome. Super excited to have you here because we're having some just phenomenal conversations with real leaders that are changing the trajectory of healthcare. And we're pretty passionate about a few different areas. We're passionate about innovation, about transformation and adoption of that innovation and access and investing. And if it's your first time tuning in, let me just sort of tell you a little bit more about what we're trying to get done here. So, we're focused on bringing real stories of innovation and leadership to life. And our aim is highlighting real people that are in the trenches, getting stuff done, making things better, and giving them the space to be able to share their stories, their little wins, their learnings with our community and ultimately with the world. So if you haven't had an opportunity to check out any of our historical interviews, wherever you are, however you're consuming this, if you're watching this, if you're listening to this, please hit the subscribe button now so that any of the new interviews come directly to you. Pretty excited about today's conversation, and I'll give you a few reasons why. So there are people who build companies, and then there are people who fund companies. And then there's a very small group of people who spend their entire careers studying why companies either succeed or fail. Today's guest is one of those people. So, Bryan Hunt is the general partner at Relevance Ventures. So, before becoming an investor, Bryan spent more than 2 decades at Wells Fargo Securities as one of the Wall Street's leading analysts. So, think about that for a second. For over 20 years, his job is to sit across from CEOs, founders, and leadership teams and basically try to answer some really hard questions like, hey, is this company built to last? Is this leadership team seeing something different that others don't? Is the market ready? And maybe even more importantly, and I think is this a great story? Or is this actually a great business? And I think after studying thousands of companies from the outside, I think Bryan eventually moved into the other side of the table. So today he helps founders build and scale companies through Relevance Ventures, where they're investing in areas like healthcare, medical technology, wellness, and businesses trying to solve meaningful problems. And and to me, Bryan brings a very relevant perspective that we need more of in healthcare because I don't think healthcare has a shortage of ideas. If anything, we have a lot of incredible scientists. We've got an amazing clinicians. We've got really awesome founders. I think the harder question for me is how do you take an idea and actually turn it into something that survives, something that scales, and even something that ultimately changes people's lives. So today we're going to talk about some things that are very interesting to me, patterns that Bryan has seen over decades of studying companies in terms of what sort of separates exceptional founders from everyone else, where innovation is headed and what it takes to build something that lasts. So Bryan, great to see you. Welcome to the show.
Wow, I'm on the other side of the screen blushing. Thank you so much. There's so much we could cover in that from that introduction. Um, I will tell you, just hitting the reset
Yeah.
on my background. I will tell you the most fascinating conversations I had really came from the analysts that were representing money managers,
Hmm.
analysts that were, portfolio managers, because their jobs were on the line. They were representing capital. That's what
Yeah.
I'm doing today.
Yeah.
And I think when you're a young analyst, a young portfolio manager representing capital, and trying to learn from an analyst like myself that had been on Wall Street for 20 years, though they ask the most difficult and innovative and ground zero questions.
Yeah. Yeah.
And to tell you, um, I came away smarter every time I was on the road. I came away with better questions every time I met with this group of individuals. And I made sure, being I guess, the old guy on the street when I was there. And we said it was like dog years when you're as a sell side analyst was like 7 years in any other job. But I always made sure when I went on the road to visit a company that I always took a couple of very smart, very young, very, I'm not going to say naive, but starting from zero people, starting
Yeah.
from zero career individuals, because they always asked the best question. When you'd been around, you're like, you understand, you believe you understand how things
Yeah.
work. But, when you ask a question, when you're starting from the beginning,
Right.
that's when you really learn a lot about the structure of the company.
Yeah.
And I'm going to keep going
Yeah.
and I'm going to hit a tangent here.
What I think is
Yeah.
fascinating is that you've built a career around judgment. So understanding people, understanding patterns, understanding whether something is real. Where do you think that initially came from? Do you think that's something that's just developed over time, or do you think there was something initially in you early on, someone influenced you? I'm just fascinated by that.
I was fascinated by money to begin with. Then I was fascinated by systems. And now over time, you realize, whether it was as a sell side analyst or in a position I'm in today, I think it's more important to find the missionaries, not the mercenaries. So
What
originally,
do
I
you
would
mean by
tell
that?
you,
What do you mean by that?
so well, I would tell you, mercenaries are in it for the money. Missionaries are in it for the purpose. And
Hmm.
when you find a founder that is trying to solve a problem that is personal to them, that's when you find the individual that won't give up. That's when you find the individuals that's not in it for the money. They're in it to solve a problem, to make whatever, and it's really about all of us, right? At the end of the day, it's all about humanity. They're trying to find a solution to improve humanity. And I listen to a lot of podcasts and I read a lot. But what you find is those missionaries, in the event of solving the problem, end up making a lot of money.
Hmm.
So if you could solve the problem and do it passionately and find one of the best solutions to whatever problem you have or whatever problem you've discovered that is personal to you, whether it happened to somebody in your family or whether it happened to one of your friends, those are the people that you put money behind because they won't quit. They will find the resource to help them solve their problem,
Mm.
whether it's funding or whether it's external expertise or whether it's through their own learnings about how to solve the problem. And there's plenty of examples of that. That I say plenty. There's several examples of that that we've invested in where
Yeah.
we found a missionary, we put money behind them, and lo and behold, it has become one of the best companies in the industry segment.
Let's talk about the example. I mean, if there's one that comes to mind, I'd love for you to share it. Share
There,
us.
there's one that comes to mind that really fits the whole healthcare mantra. And so, where we like to invest as an organization, I'll give you a little bit about our
Hmm.
organization, and then you'll see that we're missionaries, not mercenaries. Um, we come from Relevance Ventures is one of two Native independently owned venture capital firms that's independently owned by Native Americans. And so, if you look at
Hmm.
all the problems on Native American lands and on reservations, their health problems, their community problems are amplified multiple times over relative to the general population. So,
Hmm.
whether it's diabetes or mental health or just safety, housing, clean water, And so we're investing in healthcare companies that are both preventative and curative, that provide access as well. We think that is a major problem throughout the country. And so when you align all of these objectives, we decided to invest in kind of four pillars of healthcare,
Hmm.
which is community health, digital health, individual health, and financial health. And I'm not going to. This isn't a commercial for Relevance Venture,
Right,
but those are our
right.
four pillars. And so we use those filters to find this company called Talkiatry. Talkiatry has more W-2 psychiatrists on staff than any company in the United States and potentially in the world. Um, when we invested in them, the story was of the founder had a mental health challenge. He tried to use his wonderful healthcare insurance program to get access to a
Right.
provider in New York City. Lo and behold, half the
Good luck.
industry's cash pay. There's a waiting list 3 months
Yep.
long. So half the industry cash pay industry, there's a waiting list 3 months long, and I'm having a mental crisis. How do I solve my problem?
Right.
And so he ended up solving his problem, but in the process, this person was an analyst. He came from my world of high yield and leveraged loans. And so being a great analyst, he's like, there's a problem here. This is personal to me. I'm a missionary. I'm going to fix it. So we invested in Talkiatry when they had 6 psychiatrists. Now they have 800. And this is in 5 years. The company has done a study of 1,800 outcomes in depression and anxiety,
Mhm.
and their outcomes with those patients is almost 3 standard deviations better than the industry. Why? Well, Robert, the founder, and I'm not giving you any information that you
Yeah.
can't find on your
Yeah.
own.
Yeah.
His story is on their website. But Robert, the founder, realized that there was 2 problems. Not only is access a problem, but also psychiatrists are leaving the industry at a 1% clip annually. So there's psychiatrists leaving the industry.
Hmm.
Takes 8 years to grow one. How do we fix this access problem? Is one. Access is money,
Right.
but access is also technology. So their telepsychiatry, half the counties in the United States don't have a psychiatrist. 3/4 of them don't have a child psychiatrist. And there's only a couple thousand geriatric psychiatrists in the country. So how do we solve the access problem? Telepsychiatry, telehealth.
Hmm.
But what's even more important is they're starting to employ technology on the back end to help on two issues. One, if a psychiatrist isn't happy, burnout was a major problem in the industry.
Yeah.
So Robert analyzed all the problems that psychiatrists were having and how to prevent burnout. He's addressed those. So I've improved the retention of my psychiatrists.
Hmm.
I've improved access. But now, how do we really magnify the whole flywheel? It's through AI and other technologies that improve efficiency.
Right.
So if I can give my psychiatrist the opportunity to have AI help them, and I don't know if they're doing this, but I assume they are, but have AI help them process all their
Yeah.
notes,
Interesting.
file all my claims. So now I can pick up a couple of appointments, one appointment every day, maybe 5 to 6 appointments through the week. So when you expand capacity, because takes 8 years to make a new psychiatrist, but if I can
Yeah.
take my current psychiatrist and expand their capacity through technology, then all of a sudden I've created a flywheel and a new structure for practicing in the industry, which one satisfies the consumer, satisfies the
Yeah.
psychiatrist, and ultimately satisfies the need to expand capacity in this industry that's got a massive, massive shortfall. So those are
That's
those are
that's
the
no, that's so
opportunities we're
interesting.
excited about.
That's so interesting. You talk about the
So, so
mercenary versus the missionary.
yeah, mercenary
But
versus a missionary.
but,
So,
but when
well, let
they
me
but
give
when
you.
you meet it, let me ask you
Go
this:
ahead.
when you meet an exceptional CEO, was and he sounds exceptional. Was it obvious immediately, or did it look
Well,
like strange at first and took time to
I
gel?
luck. So this is where I had an advantage. I luckily had known Robert for over a decade, and
Ah,
he
okay.
was so going back to taking the smart person on the road,
Yeah.
going to meet with some of the smartest and most difficult clients in my business. Robert was always at the top of my list. So I knew he was hyper intelligent. I knew he had a work ethic unlike, you know, 90% of the people I interacted with.
Yeah.
So when he immediately took up the reins at Talkiatry and started the company, and I had started down the path of investing, I called him up and I said, "What are you doing?" He's like, "Well, I left and I started this business." I said, "Well, let me know if you need capital to back you, because I'd been investing privately on my, in private companies on my own, and I'm about to join a venture capital firm." And he checked, needless to say, when I brought my partners in, he checked all the boxes.
Yeah.
And, again, well educated, extremely well spoken, raised capital before, within his money management business that he was at previously. But he'd partnered with a psychiatrist who is extremely intelligent and had multiple different licenses, well regarded in her field, and she understood the practice side of it. And it's very important when you find a missionary that is trying to solve a problem. This is one more factor we look for. Is I usually like to have two founders.
Mm,
I like to find the missionary, and I like to find the person that has the experience within the industry, whatever it is, whether it's
yeah.
medical
Yeah.
devices or SaaS or AI, but having a very important co-founder, um, or very adept and intelligent co-founder is
Right.
extremely important, because usually the missionary, this is their first go around.
Hmm.
When you have a co-founder that has industry experience and has been through, as I like to affectionately call it, the sausage grinder before, right? They will allow you to avoid a lot of pitfalls. And I'll tell you this as well. One of the things that we like to do, in our organization, and I'm going to steal from, and I've stolen this actually from another founder, is when you look at a company that is only a handful of individuals, say 10 people,
Hmm.
your hires are so important, because you think about it. I worked at an organization that I was working at the peak of my career with 365,000 of my closest friends. So a new hire really wasn't going to impact the organization.
Right.
But when you have 10 people and you hire one more, that person accounts for, rounding, roughly 10% of the organization.
Yeah.
So running the new hires in a startup through the finest filter you can find is hyper important for us. And we try to, provide that same level of importance to the founders that are building organizations. It's like, people they're your business at the end of the day. Your hires are your business.
Hmm.
You
Hmm.
need to make sure whoever you hire is an A player. You
Yeah.
can't afford at this stage in your business to hire a B or a C player. So anyway,
You know what I always found fascinating about venture is, founders, they typically they come into the room, they've got a sound vision, ton of conviction, um, and they believe they're right. How do you separate like a visionary from someone who's simply wrong and just has a lot of confidence? Like, are there subtle signals or red flags?
Well, we run. We've got a team of three general partners, an analyst, and we run every company through a filter and a series of hurdles
Mm,
to make sure that the company meets our guidelines for investment. Usually, when we have a visionary come into the room, and they may have a brilliant idea for a new product, but it won't get traction or it won't hit. And I'll tell you, Michael, we see a deal every day.
yeah.
It's absolutely
Yeah.
incredible. So there's four of us, right? And we've got support staff, but between the four of us, we get a deal every day. So, roughly 220 work days a year. Think about it that way.
Hmm.
So we see 880 deals between us. The number, and we only invest in 4 to 5 companies a year. So to answer your question,
Yeah.
it's very quick. And usually if we're meeting them face to face, they've passed through one of our filters and they've got
Hmm.
some traction. So we look to invest in companies that are doing about $1 million at least in revenues. So
Yeah.
they've overcome a lot of hurdles to get to us, to
Hmm.
get through our filters. And so if we're dealing with just a visionary that's a seed investment that's not generating any revenues, it needs to be something very, very special for us to take a look at it.
Right.
Now, oftentimes we will meet with these visionaries pre-revenue just to get to know them because we think
Yeah.
they may have stumbled on something interesting and we want to build a relationship. And I will tell you, you talked fondly about what I do and what our organization does. One of the things that we've been recognized for is, several years in a row by Inc. being a founder-friendly organization. So, even though there might be faults in a business plan, even though and the company's got initial traction, when we invest money, we don't invest money and walk away.
Hmm.
We think that between myself and our other team members, and this goes back to some of the comments you made preliminarily, we bring knowledge to the table oftentimes these founders don't have. Spending 20 plus years on Wall Street and understanding the best practices of companies, seeing them make their mistakes and helping take
Yeah.
those multi-billion dollar companies, sometimes their learnings, and helping apply it to a new founder is revolutionary in some instances. And
Yeah.
I will tell you, I'm gonna mention another like founder that was a missionary.
Yeah. Yeah.
That
Let's hear it.
Hamdi from Chobani. We helped. I worked and covered his credit. If there's ever a founder that I've ever met that was passionate about his product, passionate about transforming the lives of his employees and the
Hmm.
health of the consumers who consume his products, it's Hamdi. That guy, and again, that's somebody who took his product door to door and to door in New York City and sold it. He took a old food plant that was owned by Kraft and turned it into a multi-billion-dollar food company. And he was the driving force
Crazy.
behind. And I would pronounce Hamdi's last name, but I would butcher it.
What about on the flip side of that? Like, what investments mistakes kind of taught you the most? Like, and kind of looking back, like, what did you miss? Sounds like you got a pretty sound process, but you don't get to a sound process just day one. What were some of the
Yeah,
ones
no,
that kind of never
yeah,
left you?
when you look at early stage venture capital, um, and I'm going to be off by several percentage points, but about
Mm,
half of them fail. And so when you look at those that have failed, um, a one that comes to mind that just hasn't failed, but it didn't play out the way I anticipated,
hmm.
and it was because you had a passionate founder. and his number two ended up being a mercenary. Again,
Mm,
lesson learned there. And unfortunately, the mercenary destroyed some relationships that the founder had created.
mm.
So, yeah, lesson learned in that particular instance. Um, Product market fit is usually there for us,
Right.
um, but yeah, I will tell you things that we've learned. Um, it's more about the people than anything. So I'm gonna switch gears real quick and say, we've chosen our field. We've chosen our battle. Our battle is preventative and curative medicine
Right.
and 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 longevity. So that's the wave we're riding. We've defined ourselves. So how do we find the best products and best people to bring those products and services to market? And I would tell you it is misreading, and you mentioned that earlier, reading people. But every
Hmm.
now and then, someone's going to slide through your filter. They're going to put
Yeah.
on they're going to put on a mask and make it through your process. And since then we started doing background checks on individuals. So lesson learned. That's how we've
Yeah. I mean, if
applied.
you're going to be deploying that much capital into someone, it makes total sense to do a background check.
Yes, and so we don't do it on every employee, but the founders
Of course.
and
Of course.
and the founders and the key lieutenants. That is a discipline that we now bring to the table, and it is. I will tell you, we haven't found anything um, extraordinary, anything that would cause us to turn away in all the background checks we've done. But that's the lesson we've learned from having one bad experience.
Yeah. Get burned once, never twice. You know,
Yep,
totally
never
understand.
twice.
One of the things that I've kind of just been noticing also is it's sometimes it's easier said than done when you talk about being very disciplined and putting people through filters. Like it's okay to say that you missed something, and even when you have all those processes in place, are
Oh yeah.
there are there ones where maybe you passed on them, but then you kind of look back and you're like, yeah, that was kind of surprising. I think investors have misses, like any misses that had some huge upside that you guys didn't end up going into that are worth noting.
We I will tell you that I'm not going to say it was a huge upside, but it was a miss recently on another behavioral health company um, that the founder had a similar experience to Robert,
Mm,
and she built an ed tech business and also came through. We have this business that we invested in called Passport, and this was when we were Relevance Capital, not Relevance Ventures.
yeah,
Hugely successful payments and compliance business. 1 in 3 cars in the United States goes through their system every day.
really.
Um, yes,
Wow.
they just partnered with the city of Arlington in Virginia. They've partnered with Chicago was their very first big contract.
Cool.
It's white labeled, but hugely successful. What's amazing about when you look at Passport parking in the background of Passport is that it was so well run by 3 founders
Hmm.
that they created a startup machine in the city of Charlotte, where Passport was founded. There's over 15 companies that have spawned out of other employees that had worked at Passport.
Wow.
And this one individual, she came from Passport. So had a great background and grounding on a startup. Two, she was building a business in behavioral health that was founded on an experience. She also was a missionary trying to solve a problem. And
Hmm.
we looked at the business. We all liked it. Unfortunately, some of the times when you miss, it's because you don't have capital at your disposal.
Yeah.
And this was one of those instances where we all liked it. And, she has since had um, multiple inquiries about buying her company. She's grown it rapidly, um, and it solves a massive problem in behavioral health on university campuses. And she's attracting buyers because of it. So, that's the
Interesting.
most recent. That's the most recent one. I would tell you also, again, Relevance Capital. One of the things we've learned is exit. How and when to exit. When capital is
Yeah.
flowing like it is today, when you have uh, the IPO market wide open
Hmm.
for a company like SpaceX, or Anthropic or
Yep.
OpenAI, and so many other support companies for the data center business that have come public in the last 6 months. It is one that's a signal that there's lots of buyers in the marketplace. And if
Yeah.
we have something that we've owned for 5 or 6 years and is performing, we ought to be encouraging management teams to exit. But we've had instances where businesses decelerate, their growth decelerate, and it's beginning to decelerate quickly. And those are the points where, as a venture capital investor, right, you need to move on and hand off your business to a strategic or private
Yeah.
equity. So, I would tell you there's so many lessons learned that, we don't have time for them.
I say we probably have to do
But
another episode on that one.
yeah, do another episode. But when you look at the capital flows in the business, there was a point in time, just after COVID, where there was no capital flowing into venture capital. It was extremely difficult for startups to raise capital, and if anything, and valuations came down precipitously. If
Hmm.
anything, that was the perfect time to have liquidity as a venture capital investors, because the leverage moved into the buyer's hands
Hmm.
versus into the seller's hands, and gave us an opportunity to structure deals that were favorable to our LPs, not only from a structure perspective but from a valuation perspective. So the capital
Before,
flows part of this industry is an amazing story in and of itself.
yeah, we're gonna have to put a pin in talking about the exit because I feel like that's probably an episode in and of itself. Um, Before I forget, where can people go to kind of follow your work, follow the work of the firm? Just kind of give a shout out for that, and then we'll kind of take it home.
Yeah, absolutely. If you want to follow, me, I am on LinkedIn, and I publish articles, every month or so. It's Bryan Bryan dot or Bryan Hunt, CFA, and you'll see a guy that looks like this in the picture on
Yeah,
LinkedIn.
we'll make sure we put the link in the description.
Yeah,
We'll
and
link
and
it.
when you go to find us on the web, you can go to our website. It's relevanceventures.com, or you can find us on LinkedIn as well. But if anybody has any questions or wishes to reach out to me and contact me, please do. I love this industry. I love what we're doing, and I love helping founders live out their dreams and solve real solutions for humanity. And I'll tell you, and I'm gonna hit a bullet point here real quick that's
Yeah, do
important to
it.
me. So when you think about what we're doing at Relevance and what others are doing in the same sandbox.
Hmm.
On preventative medicine, an overwhelming majority of the dollars spent in our healthcare system are spent on two chronic diseases and really treating the symptoms associated with chronic disease. So think about that.
Yeah.
We're not curing the chronic disease. We're not preventing the chronic disease.
Right.
We're throwing money at the symptomatic side of it.
Yeah.
There's a gigantic pendulum swing taking place, and we're investing behind it. And why that's so important? Think about this, listeners, which is if we can prevent heart disease, if we can prevent diabetes, that's roughly 80% of the chronic disease spending in this country.
Yeah.
And you can prevent those with lifestyle changes. You can do it with drugs and you can do it with devices as well,
Right.
curative. But if we can prevent those, think about the cascading effect that has on humanity. One, people can get back to work. Two, they get off of Medicare and Medicaid. And
Hmm.
three, it improves the health of our country from a financial standpoint. You can afford it, you can pay taxes, you can go to your job. We enhance the productivity of the country and we reduce the burden on our government in terms of the Medicare and Medicaid dollars they have to
Right.
spend. It's just this tidal wave of efficiency that comes from spending on preventative medicine.
You're starting to see more of that wave, that shift of people that are being more in proactive care, seeing it, companies like Function Health and the likes. You're seeing
And
more of it. And is it going to be getting
it's
more
proven
widespread?
it's proven out. If you look at studies, every dollar spent on preventative care leads to about $5.6 in savings later in life. An
Yeah.
overwhelming majority of the dollars spent on healthcare actually happened in the last decade of someone's life. So if we can improve your quality of life in those later years and extend your well-being through preventative care measures, and it's never too late. You can start dieting, you can start exercising. I say dieting, eating well and
Hmm.
exercising and committing to good habits that extend the quality of your life.
Mm. Yeah. That's a great place to add an ellipsis for us to have a long conversation. We're going to need to have more of that. I think where Thank you for today. Just even thinking about the missionary versus the mercenary, that really resonates with me, and I think that's going to change my perception of which bucket do they fall into. When you start to measure people and you're having conversations. So I think that's interesting, and just the work that you're doing and the
But
clarity and the conviction around longevity and consumerism and just being and well-being and how that aligns with the firm. So for those
we
that are,
that
yeah, go ahead.
mercenary versus mercenary. I don't want a founder to talk about exit. Let me talk about exit. If you're
Yeah.
thinking about exit, you're not thinking about the mission.
Hmm. Yeah, that is deep. For those that have tuned in, if you found this conversation to be helpful, or if you want us to explore another topic or a leader that you want to hear from, drop us a note, leave a comment. And if you wouldn't mind, if you found it helpful, reshare this. Let us know what you thought was compelling about it from your standpoint. Again, this isn't just a platform that's about content. It's about community. It's an interactive thing. So thank you for listening. Keep building with purpose, and we will see you next time on the Advancing Healthcare Innovation Show.
Thank you, Michael.
You bet.